group of mental health conditions characterized by enduring patterns of behavior, cognition, and inner experience that deviate markedly from cultural expectations and cause distress or impairment in functioning. These patterns typically manifest in adolescence or early adulthood and persist over time. There are several types of personality disorders, each with distinct features and diagnostic criteria. Here's an overview of the major types of personality disorders. Cluster A, odd or eccentric disorders. 1. Paranoid personality disorder, pervasive distrust and suspicion of others, interpreting motives as malevolent. Hypervigilance, reluctance to confide in others, and bearing grudges. 2. Schizoid personality disorder, detachment from social relationships and limited emotional expression. Preference for solitary activities, indifference to praise or criticism, and emotional coldness. 3. Schizotypal personality disorder, peculiar thoughts, beliefs, appearance, and behavior, social anxiety, limited close relationships, odd speech patterns, and perceptual distortions. Cluster B, dramatic, emotional, or erratic disorders. 1. Antisocial personality disorder, disregard for others' rights, impulsivity, deceitfulness, and lack of remorse. Persistent patterns of criminal behavior, aggression, irresponsibility, and manipulation. 2. Borderline personality disorder, intense and unstable relationships, self image, and emotions. Impulsivity, suicidal behaviors, fear of abandonment, and chronic feelings of emptiness. 3. Histrionic personality disorder, attention seeking behavior, excessive emotionality, and provocative dress or behavior. Shallow emotions, rapidly shifting emotions, and easily influenced by others. 4. Narcissistic personality disorder, grandiosity, need for admiration, and lack of empathy, sense of entitlement, exploitative behavior, and fragile self esteem. Cluster C, anxious or fearful disorders. 1. Avoidant personality disorder, social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. Avoidance of social interactions and reluctance to take risks or engage in new activities. 2. Dependent personality disorder, excessive need to be taken care of, submissive and clinging behavior, difficulty making decisions, fear of abandonment, and tolerating disagreements. 3. Obsessive compulsive personality disorder, preoccupation with orderliness, perfectionism, and control, rigidity, excessive devotion to work, inflexibility, and reluctance to delegate tasks. Diagnosis and treatment considerations. Diagnosis. Personality disorders are diagnosed based on clinical assessment, including interviews, observation, and sometimes psychological testing. The Diagnostic and Statistical Manual of Mental Disorders, DSM 5, outlines specific criteria for each personality disorder. Treatment. Treatment for personality disorders often involves a combination of psychotherapy, medications for co occurring symptoms, e.g., depression, anxiety, and support from healthcare professionals. Therapeutic approaches such as dialectical behavior therapy, DBT, cognitive behavioral therapy, CBT, and medication management may be employed depending on the individual's needs. Challenges. Individuals with personality disorders may face challenges in forming and maintaining relationships, managing emotions, and achieving personal and professional goals. Treatment aims to improve coping skills, enhance self awareness, and foster healthier interpersonal interactions. Understanding personality disorders involves recognizing the complex interplay of genetics, early life experiences, and environmental factors. Effective treatment requires a compassionate and multidisciplinary approach to address the diverse needs and challenges faced by individuals with these conditions.